welcome to another edition of Build Healthy Places Network's Video Snapshot series. My name is Ashley Hernandez, and I'm the Research and Product Manager at Build Healthy Places Network, a national center for fostering cross-sector collaboration across healthcare, public health, and community development to accelerate community-centered investments that advance health and racial equity. So this popular video series provides a brief insight into the world of practitioners, experts, and organizations from the community development, health, and finance sectors working together to make communities healthier. The series uplifts practices, projects, and policies that support community engagement processes that are community-led and owned. And in this interview, we're going to talk about the Healthy Neighborhood Study, a participatory action research study that explores how new developments change neighborhood conditions and how those changes impact the health and well-being of people living there. So I'm so excited today to speak with Vidette Gavin, a senior research consultant at the Conservation Law Foundation and co-principal investigator of the Healthy Neighborhood Study, and Andrew Cedar, a research scientist for participatory methods and training for the Healthy Neighborhood Study at the Conservation Law Foundation. So thank you, Vidette and Andrew, for joining us today. And my first question is, while leading the development of the Healthy Neighborhood Study, Conservation Law Foundation was very intentional with incorporating a community-first model. Can you describe how that was done? And Vidette, would you like to start?
I can start off, and I'm sure Andrew, you'll jump in and pick up wherever. So in the development of H&S, one of the most important things was really trying to get clear on what we were trying to learn. Initially, the opportunity to start the study came from another piece of work that we were doing called the Healthy Neighborhoods Equity Fund at Conservation Law Foundation. And that work had an advisory team of planners and public health folks who were all really interested in learning how to invest in communities in ways that created the type of development that communities wanted. And they had a little piece of evaluation support and an opportunity to do an evaluation. And one of the things that was really clear to us is there was a lot to learn about how we understand the impacts of development on health. Like, what does it mean to understand that? And so really the PAR approach and the focus in H&S came from understanding that there were a lot of different perceptions of what was even happening with development. It took a lot of collaboration to even name the challenge that we were trying to address through the research, and therefore understand what difference the research could make. So, circa 2014, there were a lot of people who were saying, well, this is an issue of smart growth. This is about figuring out how to make the best investments in smart growth in historically disinvested communities. And then other people were like, no. This is actually about a regional housing crisis. And this is about trying to find, middle income housing for, working families. No. What this is gentrification. And this is about everything that I know and love being, ripped out of my community culturally, us not being able to afford staying here, our movement being policed. So depending upon who you ask, it's like that meme of it's really a cartoon. I'm aging myself. But like of the elephant that's in the middle of the table and everybody has on blindfolds and they're touching it. And one's like, no, it's a hose. No, it's a table. No, it's a whatever. And it's an elephant. It was like that in the beginning. So the focus on PAR is like, well, who would actually know what it is? It's the people who are living through it and who are working on it every day that have the most integrated intersectional expertise and understanding of the impact of these types of developments that we were investing in on their overall well-being. And we should look to them to tell us what are even the right questions to ask. What is the information that we could gather through research that will make the most important difference for you in your daily lives as residents, as organizers, as advocates, even as people working in planning, because everybody has a neighborhood somewhere, right? So like, what is it that we actually need to know to solve this problem versus how can we prove that what we are doing is making, we think is making health better? Like, according to who and whose health? So we had to figure all of that out. And that was kind of the introduction of the use of PAR.
And Andrew, would you like to add anything?
Deb did a very good job describing that early work, and it's thanks to her leadership and the other co-PI, Dr. Mariana Arcaya and Dr. Andrew Benet, who were the three who were the principal organizers and conveners and coordinators and researchers when the ball was just getting going. And then once the space was convened, it's really, the hats off to the residents themselves, our resident researchers, who are the ones driving this work forward. And we sometimes talk about PAR, participatory action research, as like an ideal that we're trying to meet. And not just something that it's not like following a recipe or something like that, where if you just have all the right ingredients and you put them together in the right way, you'll have this, this delicious meal or what have you. We can talk about the different parts of a strong PAR project, but at the end of the day, it's about the relationships and it's about building power together. And I think we've been very successful at that over these years, and I'm happy to be part of the project. One other aspect of this that I would share about the beginning is, with participatory action research, there is indeed an emphasis on action. And a lot of our community partners and our residents and staff are and were community organizers out to try to change something or to stop some change from happening in their neighborhoods. And because we had that action orientation, it's not like we were just sort of doing research for research's sake and we're curious about something and, would go look up the numbers or what have you. We were very much trying to, and still are, shifting power dynamics in terms of who gets a right to know what, who has the right to be heard. How do we shunt and redirect the community sources of knowledge to institutional audiences and mainstream audiences in a way that actually benefits the residents in their communities?
Great, and you two touched on this, but wondering if you can elaborate, which is how this approach can be used to impact neighborhood change, especially in regard to prioritizing residents' concerns throughout new neighborhood developments. And of course, Andrew or Vidette, either of you can start.
Okay, I'm happy to take a crack at it. Sometimes when we talk about this work, it can seem like we're talking about like every community or all communities or what have you. And while we think, PAR is a powerful way to speak truth to power, it isn't always working with communities. Let me rephrase this. All right, so this is one of those, like, if you can cut, but if not, that's okay. So in terms of neighborhood change, we're not just talking about all communities. We're talking about communities which have been historically and presently oppressed by the systems of domination and the legacies of historical racism and injustice, and trying to turn and change the conversation about gentrification, which when this first started, the conversation in metropolitan Boston was very like supply side focused. We just don't have enough housing. We just don't have enough housing. We just need to build more housing. And like that was kind of the end of the conversation. And it's great to have more homes, right? But the kind of development, how the development happens, for whom it's actually affordable, where it happens, what it looks like, all of these things actually matter for the health and well-being of residents living in those neighborhoods. And I like to think that by turning the attention to lived experience and the perception of neighborhood change, we've helped to change some of the dynamics about how housing gets developed in these neighborhoods. And again, back to the PowerPoint, actively trying to shift power so that the residents in these neighborhoods have more control over the kind of development happening in their neighborhoods. And in a lot of, like the other side of the coin is that there are a lot of affluent suburban communities in metropolitan Boston who have had that luxury and that privilege for many, many, many years. And we're just trying to, we think that this kind of research can be very valuable in organizing and movement building to more just housing development.
The other thing that I would say about that is that PAR as a participatory approach is, like Andrew said, really seeks to improve the world by acting to change it and using research to catalyze those actions and make those actions more effective and understand what it takes to get to the different future and the different possibility that we, are striving to achieve. And in that, residents themselves are the ones, and advocates who are dealing with these issues every day are the ones naming the question, saying what we should measure, making meaning of the information, and then they are the ones doing the translation to practice. The practitioners themselves, the residents themselves are lifting up things into practice that will strengthen all of our practice, that because it's really centered on the liberation and health and well-being of the people who are and have been oppressed, right? And so if you take this, PAR can be applied to any research method. It's not just qualitative, it's not, it can be quantitative, it can be ethnographic, it can be observational, so it can be big data, right? And so some of the things that we're able to do is say, hey, on average, practitioners are paying attention to things like increasing people's steps. What does that mean in the complexity of increasing the number of steps that I take when I can't afford transit and now my job is 2 hours away? What does that actually in a complex system mean? So it gives us the ability to ground the research and say what is most important about the ways that neighborhoods change for the people who were already living there, and for those people who, when we look at the distribution of population health, for those people who are always in the bottom tail. Those people, what does it mean for a neighborhood to work for them? Well, let's ask questions about that and their lived experience, right? And figure out then what we need to measure and what we need to learn, and therefore what steps we need to take in order to ensure that our investments, our design, our work with community is actually serving those people. And that looks like finding new things like ownership of change, one of our new measures and pathways that says, hey, people have been looking at, like Andrew said, what is built? How active and safe is this design? How much green space? What is the air quality? But they're not looking at who has control over what is built and who benefits from what is built. That is called ownership of change. It looks at how well people are able to meet their priorities in the place where they live. Another thing that on average, when you look at an indicators board that tells you about communities' health, they're not giving you an indicator on self-determination. They're not giving you an indicator on how much people can achieve their life goals where they are, be that education, be that saving money, be that a healthy and strong family, right? Relationships. Prioritization matters for health. And so people are able to lift up. These are the signals that science and practitioners haven't been paying attention to. We can call them out. We can prove that they matter in this pathway from what is built to how it affects people. And we can tell you how to intervene on those pathways in order to make those outcomes better. Those are like the concrete ways that we think our research, led by community partners, led by those residents, are really contributing to changes in the way that we think about and plan for and build and invest in healthy communities.
Thank you. So for other institutions who are looking to center community voice and engagement in their research and work, what do you think are the key elements that are essential for doing this successfully? And again, either Andrew or Vidette, either of you can jump in.
For an institution to do this kind of work effectively and meaningfully and authentically, I would say the organization needs to have already gone through its own reckoning, its own review of the impact that they themselves have had in the neighborhood where they're talking about doing some more work. Because a lot of time, right, like for some of these communities, you've got generations of family living in the same place, right? Decade after decade after decade, and they've seen these institutions come around, every once in a while, and sometimes there is harm that's done. Sometimes it's clear that there's just tokenization happening, or it's just like a PR stunt. And many communities are tired of that, and there's not a lot of trust there. So to demonstrate that the trust is actually, that these institutions can be trusted, there should be some evidence that they know the history, that they know the context of the community in which they're about to wade into. So once they have that history down and they're interested in building trust, the next thing would be to show up. To show up and listen in community spaces without barreling in with their own agenda or what have you, and just being present and learning about the space, learning about the community, and slowly develop sort of trust over time and get to know what the real issues are. Sometimes the institution should just be a broker of resources and just sort of pass through cash or pass through other kinds of resources and kind of stand back and let the community do what the community wants to do. To do PAR, like we had mentioned earlier about it being an ideal, is an institution prepared to cede power or cede control over certain kinds of decision making, over certain resource pools? Are they willing to open up budget review to a community? Are they willing to open up board seats to a community? In what way is it not just sort of a one direction flow of information, like extracting from residents for the purposes of some, behind closed doors institutional decision making? How much of it is that versus how much of it is a true, a relationship, a back and forth relationship? So I would certainly say it's possible, but it's not, community engagement and building power with historically marginalized communities takes time. It takes resources. It's very high touch. It can be slow, but that's not necessarily a bad thing. And it's got to look really different from what immediately pops up into people's minds, I think. So yeah, it's possible, but you got to take the time.
Yeah, I think the only things I would add to that, like absolutely all the things for the disposition of an organization and to be very real about what they are not willing to do. And it's in addition to that, I would say, like, with that listening, really understand and prioritize the futures that communities want. Their vision statement, their priorities, their preferences about how to achieve those priorities, and focus the work on making those things true. Build your theory of change around the change that a community articulates for itself. Do the work to say, okay, communities are not monoliths. How do I engage in this thoughtful series of conversations? How do I connect with all of the different nodes of this community, be it at the neighborhood scale or a regional level, to understand what are the common futures? And then who do they break apart for? And then who do our systems and processes currently fail and never work for? And center them, right? Because the thing about PAR is it is a research praxis that is focused on justice. So instead of saying this is about the distribution of benefits and harms, this is about the elimination of harm for the people who are always harmed. And it's about the repair of those wrongs for the people who have been harmed, right? So it's a justice-oriented research practice. And the other thing that I would say is, like Andrew said, bring all the resources of your institution to bear and weight community knowledge as valid and valuable. We hear a lot of times from colleagues, well, that's just anecdotal. How do we know that? It came from literally 8,000 residents that have been surveyed over almost a decade, and it's still anecdotal, right? So recognize that all information is socially produced. And hearing from the knowledge and wisdom of community is a valid source of knowledge and wisdom, because if it were in a community of affluence and power and someone on their planning board says, for fact, the housing needs in this community are this, this, and this, someone would say, yes, that is a fact because of that person's position. But because organizations and residents in places that have been oppressed, disinvested, and not listened to don't have the financial resources or structural position that we honor, then we call their knowledge anecdotal, and it needs to be proven. Flip that dynamic. And when you do that and pair that with prioritizing what it is that they want, you find powerful ways to make investments in the things that are catalytic, rather than figuring out how you become better at doing the thing you already know how to do, which we know doesn't work for that group of people, right? So it's like, solve the new problem that will actually lead to inclusion and liberation for that group of people, rather than focusing on working with communities to get better at doing what we think we're great at, which does not serve them, right? So I think that's what I would say.
Great. Anything else either of you would like to add?
Yeah, you all, if you're watching this video, you should check out our website, hns.mit.edu. It's got a lot of great resources and our papers and stuff like that. I'll give a shout out to the website. Yeah, that's how you can reach us.
Yeah, and we will definitely include a link to your website and other resources along with this video. And just want to say thank you so much, Fidette and Andrew, for joining us today and sharing your wealth of knowledge around participatory action research and really how that can be used to help make investments in community more equitable. So thank you again, and thank you to the audience for joining us. And I hope you will join us again for our next video snapshot.